I'm Dr. Shane Williams. I'm a cardiologist. It's well accepted that plant-based diets reduce the rate of developing certain deadly diseases such as cancer, heart disease, and diabetes. And it's also, there are a growing body of evidence accumulating day by day that even once you develop one of these very serious and potentially life-threatening diseases, changing your eating habits towards a whole food plant-based diet can actually change the progress of the disease even after it's grabs hold of the patient. And by having an impact on deadly diseases, they become less deadly and lives are saved by changing people's lifestyle, especially their nutrition. But even more important than people living longer is living the years people have remaining better. People want an improvement in their quantity of life. They want to live longer, but they also definitely want to live better. And taken to extremes, if somebody has to adopt something that's very unpleasant and have a lot of suffering, but just simply live longer, and an example of this might be chemotherapy that may or may not be proven to be very effective, that they suffer, they might live a few months longer, but they spend those months in dire suffering and nauseated and unwell. So that's an example where you may improve survival, but not actually ultimately do good because a person's quality of life is critical. And yet I see consistently in my clinic witnessing people as they adopt a plant-based lifestyle, they consistently report improvements in quality of life. They tend to have more energy, they feel lighter, they sleep better, their bowels work better, they immediately don't need reading material for the washroom anymore, which is often a problem that preceded this lifestyle change for many years. So these are aspects of health that are very, very difficult to quantify in the clinical trial. How somebody's feeling or their energy. We find it really tough as scientists to actually quantify that and to prove an improvement of one intervention over another. And yet consistently, if you ask anybody who's trying to eat less animal-based products and more plant-based products and ask them how are they feeling, how's their energy, even above and beyond the improvements of blood pressure, blood sugar, and weight, they consistently report a qualitative improvement of overall zest and zing and energy in their lives. And that's one of the reasons why I'm also and been very passionate about trying to get people into immersion programs where they literally test drive a plant-based lifestyle for 5 or 7 or 10 days. Once a heavy meat eater feels what it's like to eat more plants and less animal products, their awareness of the link between what they eat and how they feel is forever changed. And I think those are powerful experiences then that when the person looks to making the effort to changing their lifestyle, their meal planning, and all the efforts that it does take, because it doesn't come effortlessly, that person then can think back of, hey, where's my end goal? Where's the ultimate goal here? And is this worthwhile? And they remember how good they felt when they ate and took better care of their nutrition. And with respect to improvement in survival and quality of life, a plant-based lifestyle almost always makes a patient less dependent on prescription medication. And as a pharmacist and a physician, I know that I've observed many of my patients go from 10 prescription meds down to 3 prescription meds, or 7 prescription meds down to 2 prescription meds in as little as 4 to 6 weeks after adopting a plant-based lifestyle. This translates into improved quality of life, as well as almost certainly improved quantity of life. Improved quality of life, because who wants to sit down and eat a bowl of pills a few times a day and then pay your local pharmacy a few $100s a month to have the privilege to do so? And then the other one is that because increased prescription use and over-prescription use is associated with the number 3 killer of people in North America. Number 1 being cardiac disease, number 2 being cancer and its related diseases, and number 3 being complications from medical care, which includes prescription drugs used at assigned doses. And so, and given the fact that of the awareness and scientific study showing that cancer and cardiovascular disease, the number 1 and number 2 killer, is associated, their development and progress are associated closely with lifestyle issues such as nutrition, exercise, smoking, alcohol intake. It basically means number 1, 2, and 3 risk of dying in North America is heavily linked with lifestyle choices, particularly related to nutrition, exercise, and just basic things that we take for granted every day that are not related to prescription drugs. And this is proven by the Global Burden of Disease research that's come out, supported by the Bill and Melinda Gates Foundation, showing that poor lifestyle is the number 1 reason, and its related problems is the number 1 reason why people in North America, as well as globally, why people perish. Many of you have seen the recent medical reports showing that since the COVID-19 pandemic, access to routine medical care has been reduced. And initially there were concerns that basic things that are not going to get looked after are actually going to progress, and ultimately is going to lead to an increased death rate amongst the population. Well, guess what's happened? It's kind of an uncomfortable result, but an interesting one that actually is very provocative and asks us, is the level of medical care, are the prescriptions that are being prescribed, are we overusing prescription medications? And in fact, what's happening is that rates of measures in the population or overall health are actually going up as routine medical care is actually reduced. So again, I'm not here to tell you that routine medical care is across the board a bad thing, but too much medical care, just like too much of anything that may start off as good, can turn into a bad situation. And the question is then what drives a lot of this medical care? Is it that more medical care is going to mean better outcomes? Well, the data suggested that that's not the case. So there is a sweet spot where no medical care at all is not good. Too much medical care almost certainly is also not good, because the rates of complications from overprescribing prescription drugs, too many interventions that really don't change outcomes, are going to lead to poorer health in the community. Prescription medications themselves, for the most part, are not bad per se, but their overuse and misuse are a part of a bad situation. So stay away from too many prescription medications. Eat healthy, get exercise and fresh air, and make high quality sleep a priority. Avoid unnecessary trips to the doctor and hospital. As Dr. John McDougall says, don't go there. Haven't you noticed? They're filled with sick people. And don't get me wrong, if you think you have pneumonia or in the middle of a heart attack and you need urgent medical care, but how about preventing an event upstream before the obvious problem starts? The best treatment for a heart attack is the preventative steps taken to avoid it from happening in the first place. So stay well. See you next time.